Case. Naima, a 38-year-old lady from Nevasha, presents at the clinic with complaints of serious unexplained fatigue, fever, and persistent joint pain. She also complains of a rash on her face that worsened after her recent trip to Kisumu. What is your initial impression? You can choose to pause. The initial impression: systemic lupus erythematosus, SLE. Reasons: characteristic malar butterfly rash consistent of clinical symptoms, and also her sex, which is female. SLE is a largely clinical diagnosis. What are some clinical and immunological criteria for SLE? You can pause. For the clinical criteria, we have the constitutional symptoms like fever, hematological symptoms like low platelet count, and autoimmune hemolysis. You also have neuropsychiatric symptoms: delirium, psychosis, or seizures. Mucocutaneous, oral ulcers, cutaneous lupus, or discoid lupus. You could also have psoriasis, joint involvement, or renal involvement. For the immunological criteria, you have SLE, which has specific antibodies like anti-dsDNA, anti-SM antibodies, and others. You also have low complement, C3 and C4 is low. Antiphospholipid antibodies. Further history reveals that she had 4 miscarriages. On general examination, you observe that she has grade 2+ pitting edema. On auscultation, a murmur is heard at the apex. What would explain all these findings considering her presenting history? You can choose to pause. For possible causes, the cause of recurrent pregnancy loss shows the lupus anticoagulant or antiphospholipid antibodies. And pitting edema is a sign of lupus nephritis. The murmur could be Leibniz sac endocarditis. Four different investigations would you consider for this patient and why? And what management options would you consider? You can choose to pause. Investigations. You can do ANA titers, antigen-specific ANAs like anti-dsDNA, anti-SM for the suspected SLE, antiphospholipid antibodies for the suspected antiphospholipid syndrome, and a history of recurrent pregnancy loss. For renal function tests and possibly renal biopsy could then demonstrate lupus nephritis, and the echocardiography can show the Leibniz sac endocarditis. For management, consider pharmacotherapy like hydroxychloroquine, glucocorticoids, and other immunosuppressive agents. Supportive, you could have vaccination that treat any other infections. Non-pharmacological is lifestyle modification and UV light avoidance. NB, this information is not exhaustive. SLE in Kenya. You can find out more about the stories on YouTube. The statistics from the East African Medical Journal. And the champions, the Lupus Foundation of Kenya. Results: a total of 166 patients diagnosed with SLE between the years of 2007 and 2017 were included in this study. 92.2% of the patients were females, while males constituted of 7.8% of the study population. 79.5% of the patients were females aged 18 to 60. Conclusion: SLE in KNH is common among females within the childbearing age of 18 to 45 years. Recommendations: public awareness about SLE should be improved so as to educate the public on signs and symptoms to enable early screening and diagnosis. Bonus question. Type your answer in the comments. What screening test may give a false positive result in patients with SLE? Thank you for listening to XYZZ Med.
XYZ, XYZ, XYZ.